Hello, I'm Urologist Erdem Akkaya. Today we will talk about the causes and treatment methods of erectile dysfunction in men under the age of 30. In fact, erectile dysfunction in men under the age of 30 is not at all rare. Almost every day, male patients under the age of 30 come to our clinic with erectile dysfunction. Of course, as it is known, erectile dysfunction occurs in almost half of men who reach the age of 50. To a greater or lesser extent, they have problems with sexuality. Around the age of 30, this can usually be around 15% or 20%. One of the most common causes is sexual inexperience, and this is very important. A man must know about both male and female sexual organs in every detail. Sexual experience is also very important. Actually, it is also very important to know. It is very important to get the right information. Unfortunately, people get as much information about sexuality as they can from Google or from their friends. Then sometimes they feel like they have hit a wall. Also, erroneous information is a very big problem. There may be erroneous information people hear from other people. They can get it right or completely wrong on the internet. Besides that, what is it to masturbate in a harmful way? Result-oriented, in a very short time, too many times with too much pressure, and in a dry way. When you masturbate traumatically in this way, then when your sexual life starts, there may be problems related to sexuality, such as premature ejaculation, late ejaculation, or problems such as not feeling the penis in the vagina, not feeling the penis when it enters, and not getting pleasure. Apart from that, the female partner factor. Why is the female partner factor important? The female partner might seriously criticize the man. When she says that he has a small penis, that he cannot have good sexual intercourse, and that she is not satisfied. It can cause permanent trauma and permanent scars on the man. I mean, sometimes 10 urologists can't fix a word a woman says. It is not possible. It is not really possible to pull the person out of that pit. So the partner factor is also very important. And also pornography. The person who watches pornography can sometimes confuse real sex with this virtual sex. He can think that everything in sexual intercourse is going to be like in this pornography. But when he sees a hair on her breast, when he sees a crack on her thighs, everything can change in an instant. You should not watch pornography too much. Because when you watch it excessively, the brain can confuse which is real and which is virtual. Apart from that, sometimes sexual identity is not clear in some patients. The lack of clarity of sexual identity is this: sometimes during puberty or after puberty is over, the person is still a man, but he cannot decide whether he is attracted to men or women. He sometimes has a sexual identity crisis even though it is rare. In order to decide, it is necessary to get the support of a psychiatrist. It's a difficult situation, it's really a difficult situation to get out of. There is also a situation like this. Apart from that, I think it is absolutely important for men under the age of 30 to have a proper diet. They might think, I'm young, nothing can happen to me anyway, and it can be really bad for them not to eat well. They consume garbage diets and garbage foods. For example, let's say you had a pastry and tea in the morning, a pizza in the afternoon, and roasted meat in the evening. There are no micronutrients here, there is no proper magnesium, no potassium, no calcium, no vitamin minerals. So here you put energy into the body, you put in carbohydrates, you put in proteins. But we need micronutrients to adapt them to the body that will ensure their cycle in the body, friends. You can get them from vegetables and fruits. You cannot get them in any other way. For example, I see a lot of folic acid deficiency and B12 deficiency in many young people. I mean, these are vitamins that we can measure. But apart from that, we cannot detect vitamin C. In order to test it, we need to send the blood to very specialized laboratories. These are tests other than routine tests. And we need to pay attention to them. Excessive consumption of alcohol and smoking. When there is excessive alcohol and smoking, mitochondrial functions, intracellular functions, and intracellular energy systems start to deteriorate. When the body is struggling to detoxify to get rid of them, the body has no energy to spend on other things. Apart from that, an excessively intense work pace can also lead to erectile dysfunction. So if your erectile dysfunction, for example, if it continues for more than, say, a month. Our textbooks say 3 months, but for young people I think it's a shorter period. In other words, you should not immediately label or stigmatize yourself because you have had erectile dysfunction once or twice. If the person does not have underlying macropathology, such as vascular disease, heart disease, or diabetes, I think 98% of erectile dysfunction in young people improves. Of course, there are stubborn cases, regular patients. Of course there are. We need to evaluate them in more detail. It is often much easier for young people to overcome problems, as long as the right information is available at the right time. I think if there are such misconceptions and erroneous information in his mind, he should correct them as soon as possible. Because something from youth can continue until one's old age. Inexperience, lack of knowledge, and the trauma created in the head by that misinformation unfortunately continue until maybe the end of life. If there is a problem of premature ejaculation, I think it would be very good to gather information about it and get professional support. Because I have met many people who are still in their 60s and say that they ejaculated in 1 minute for the last 30 years. That's why sexual knowledge is important. Thank you for listening. Best regards.